result of your child's treatment, there will probably be behavioural changes. For instance, steroids, which may be given to reduce swelling, not only make you extremely hungry and can affect sleeping, they can also affect your child's mood, making them demanding and angry. Try not to worry too much. It's the medication, not the cancer, that's doing this. Their behaviour should improve after treatment.
In my learning from families, children's behaviour may change in a number of ways, and it's very difficult to disentangle is that how they would be at that age, because children are growing. Is that, a normal age thing that they would have been like anyway? Is it to do with the illness itself? Is it to do with medication? Is it to do with their emotional reaction to everything that they're experiencing? So I think changes in behaviour are inevitable. I think one of the key things in my learning from families is that those experiences are difficult for the child and for the parent, because the child may find themselves behaving in ways they don't really want to, but and be full of regret later, and parents are sometimes seeing a child behave in a way that is totally outside their normal range of behaviour.
I was just your average 12-year-old, sporty, athletic, whatever, and steroids changed everything, It was all a bit of a mess.
Danielle's behaviour really changed when she was put on steroids. When we first went into hospital, she was quite a placid little thing. In fact, she'd always been, right up until we went into hospital, placid, easygoing, quiet, didn't really know I had her, and turned into this awful beastie. After about a week or two on steroids, it was like we just expected her to sit in bed and her head turned out. She was just horrible, really awful. And it's not until you go on to a ward with children that are all like it that you actually think, well, it's not your child, it's just it's the medication that makes them like it. That makes you feel better. But it was a dramatic change. And looking back now, I think it was quite funny, but it wasn't at the time. It wasn't funny, it was awful. And she did train, like I say, dramatically. She used to swear, she used to have awful outbursts. But apparently that's normal.
It is natural to want to relax certain rules and limits because of your child's illness. Many parents want to treat their child or give extra privileges because they feel sorry for what their child is going through. However, your child could find this special treatment overwhelming, confusing and frightening. Siblings too may begin to resent your child with cancer. Setting boundaries and making sure your child adheres to certain limits can be much more beneficial to your child during treatment.
All children need boundaries and security, and wherever the behaviour is driven from, there needs to be, children do need a clear kind of expectation of what's appropriate and what's not appropriate, and that there needs to be some kind of boundaries and around that.
And just used to try and stay as chilled as I can around her, and not to take too much notice of any of the tantrums that she was having, and chill as much as you can, really.
Children are living within families. Very hard, I know, for many siblings who see a sibling's behaviour change, and then maybe being allowed, as a sibling would see it, to get away with it.
Once Camille came off the steroids, the dexamethasone, her appetite started to go downhill quite rapidly. While she was on the dexamethasone, she'd eat anything in sight, which was that was one of the upsides of the drug, because for so long she hadn't eaten, and now, she was eating anything in sight.
I had to have an adult dose of steroids, so that made me very hungry.
I used to wake up at like 2-3 o'clock in the morning for a picnic, for sandwiches, for cake, and I'd quite often go up to the parents' room at 3 o'clock and everyone would be frantically cooking for their kids because the steroids had kicked in and they were all starving. So it was one thing to the other with Danielle. She did go from eating absolutely nothing, where it was so difficult to get anything down her, to eating everything that was in sight, really. And when it was time for her to go down for an op, starving her was a complete nightmare. And even one day I remember the chef on the ward saying to Danielle, "I can't give you anything, Danielle, because I've not been shopping and the oven's broke." Because we couldn't keep her away from the kitchen. It was just like, I need food. And obviously with an anaesthetic, you can't have food. So it did go, I have to say, from one extreme to the other with her eating, definitely.
I used to eat a lot of fruit because that's like the only thing I'd eat. And my dietitian used to say put it in chocolate or something because they needed to get some fat into me.
If you have been affected by childhood cancer and would like advice, or simply to talk to someone who understands, please go to the Joss Searchlight website, www.josssearchlight.org.uk, where you can find full contact information. Thank you.
You start off with something in your mind, she's not having this, she's not having that, and then by the end of it you're just like, yeah, give her whatever she wants basically, whatever's going to make her better, just give her it.